All right. Good morning, everyone. We are about to start another NCLEX class for today. All right. So let me get set up real quick, please. And if you are joining the class today, kindly join the comment section. All right. We're going to do a class today. Join the comment section. This will be a very interactive class. Tell me where you guys are coming from so we can acknowledge you today. All right. So more people are still joining. Good morning, everyone. We are about to start with another Next Gen NCLEX lesson. All right. And I will be your host for today. My social media name is right here. Where is it? Right there. It's Dr. Nurse Paul. And if you haven't followed me on Facebook, TikTok, Instagram, and LinkedIn, kindly do so. Today's show is hosted by AMN Healthcare International and Aspire RN. This show is actually called AMN Academy, where every month, right, I do classes for free hosted by AMN in their page and also in my page at Dr. Nurse Paul, right? And we have followers and nurses joining us from Ruchini is joining us from Sri Lanka. Karen is joining us from Riyadh. Hashini is joining us from, oh, she didn't say. Good morning, Hashini. Thank you. Patrick is joining us from Bataan, Philippines. McMary, Germany. Pam, Saudi Arabia. KM, Abu Dhabi. Annie from UAE. So today's class is going to be fun. All right. I do this every third Monday of the month. So this is a regular schedule. Third Monday of the month. And it's 7 a.m. Central Time. I am based in Houston, Texas. So for those who do not know me, my name is Paul. In social media, my name is DNP or Dr. Nurse Paul. I'm an NCLEX educator for 16 years. I also own my NCLEX company called Aspire RN. We are active in social media. I have my website, aspirern.com. If you guys are interested with NCLEX review, I can help you. I specialize with international graduate nurses. I have 98% pass rates. And I'm partnered with AMN and many other organizations helping nurses bring them here to the US, starting with passing with the NCLEX. All right. I'm also very active in social media. I have advocacies that are geared for international nurses or immigrant nurses coming here to the States. Make sure that you guys are well taken care of, represented, offering mentorship and support and collaboration for you guys. So lots of advocacies in social media. I'm also very active with many different Facebook groups, particularly in Lefora. This is one of the biggest Facebook group for international nurses. All right. And we're going to talk about my review program later. Nicole, send me a message, private message. I can talk to you later after the show. All right. So I'm still waiting for more people. We have Jel coming from the Philippines, Ugoda joining us from Sri Lanka. Oops. My seat. I almost fell. All right. And Hashini is from Sri Lanka. I think some of you guys are my students. Dance is joining us from La Union, Philippines. Yvette is from San Antonio, Texas. Yvette, you're about 3 hours drive for me. I am from Houston, Texas. I'm based here in Houston. It's a beautiful sunny morning. It's been raining the past few days, but finally I see the sun this morning, and it's 7:04 a.m. here. Still waiting for more people to join our show today. Very excited to do this. Last month, I was not able to do the show because I had a little vacation in the Philippines to visit my mom and my grandma. I don't go home a lot, but it was my grandma's 85th birthday and my mom's 67th birthday. So I visited them, surprised them. Was not able to do a show because of that. But I'm happy to be back. Again, this is AMN Academy, and this show is hosted by AMN and Aspire RN. and Dr. Nurse Paul. Free Next Gen NCLEX classes every Monday, third Monday of the month. AMN Academy hosts a show every Monday, actually. So follow them on their page. A lot of you guys are following AMN as well. AMN Healthcare International. They do classes every Monday, and we're rotating, all right? NCLEX lessons, English lessons like IELTS or OET. But with me, I do it every third Monday of the month. And I love to do free classes online. It's also my way of giving back to the community because some of the nurses don't have enough funds to do or to enroll in an NCLEX program, right? Gabriella is one of my followers, just joining us from Bucharest, Romania. Arlene is joining us from Jamaica. Arlene is a familiar name. She always joins in our live classes. Hashini is in Sri Lanka. Yes, Hashini is actually my student. She's for my Sri Lanka 4 batch. Anne is from Southern Leyte, Philippines. Good morning, everyone. All right. Okay, so today, fun thing that we're going to do today is, let me see. All right, so today I'm actually going to give out a free NCLEX review course for one lucky winner. And to join that, that's worth $550, by the way. That's 1 year unlimited review course, 42 live sessions, 5,000 questions in the question banks, and personal mentorship and more. All right. So one of the best review programs out there. This is based on my 16 to 17 years of being a nurse educator. I've already helped thousands of nurses that are successfully thriving here in the States, in Canada, and in Australia from passing the NCLEX. All right. So I developed this evidence-based method called DNP method, obviously named after me. All right, and let me help you pass that NCLEX. This is worth $550. There will be one lucky winner. Pick up your phones and enter that QR code, and we are going to monitor your responses. This is very quick. It only takes you 2 minutes to answer. You just provide your name and emails, and after that, you're part of the draw, right? And if we have time later, I will draw it live. And if not, I will draw it within the day. All right. And post it on my social media account. All right. But join that. I will give out one free NCLEX DNP method. It's worth $550, y'all. So don't miss this chance. If you cannot open the QR code, we have posted the link, all right, in the comment section. So let me post it for my followers as well, because we're co-streaming it today in my web page or in my social media pages along with AMN International. Thank you, AMN. Thank you, Miss Melanis. Thank you, Luciana, for always inviting me. I'm always happy to work with AMN. They've always invited me to do shows, podcasts, free classes for their followers, which I love to do. I love to pay back to the community. I feel like I've been blessed with so many things, and one way for me to, help nurses come over here is by sharing my time. So for me, time is the most valuable resources, right? One of the most valuable resources. So by sharing my time, I feel like I'm contributing to the community. Hello, Donna. All right, so have you guys seen the link? If you can flash it in the screen as well. It's a little, it's hard to remember. It was my mistake. I didn't create a link that's easy to remember. But again, for today, anyone who's watching live has a chance to win an NCLEX course worth $550, mentorship with me, one lucky winner. If you just check that QR code out, answer the survey for less than 2 minutes, probably less than a minute. And for those who did already say yes, I answered or I entered a draw or something. All right, I've also posted it in the comments section, the link, so you guys can click it and answer that right now. All right, and quick overview about the NCLEX. Good luck, Ken. Good luck, Janie. They already put in their entry. While waiting for more followers to join, currently in my page, there's already 75 followers watching us live, which is good. I have followers from all over the world. And thank you for joining the show today and participating. And while waiting for more people, I would like to talk about NCLEX because I know I have followers that are new nurses and they just passed the board exam, particularly in the Philippines, my original country where I came from. But I also have followers all over the world. So if you're a new nurse or you're a nurse considering NCLEX, let's talk about NCLEX, right? Anyway, Joseph was asking, Joseph Roberts is asking how to win. All you got to do is enter the raffle and join me in the class today. All right. And we're going to draw it later. Arlene already put in her entry and Karen as well. Ooh, this is exciting. Thank you, guys. It's just basically put your name in because what I'm going to do is I'm going to put it on a, I'll copy the names. I'll put it on the raffle box. So there's a wheel. It's online. So I'll put the name there. I'll paste it there. Then I'm going to click draw and then the wheel will spin. All right. If you know what I mean. I did this before, but I haven't done it for a bit. But last year in my free NCLEX classes, I do it. Probably going to do it regularly now. But what I do is I put all your names in a box and it goes to the spinner. All right. It's digital. Everything is done through the internet. And then I click the spin and it picks a winner. Okay. So it's not a survey. You don't have to answer a lot of things. There's already 100 followers um, in my page today. That's not including AMN International, which we're also live streaming today. Thank you, AMN, again for hosting the show. Follow AMN International along with DrNursePaul for free classes every Monday. And you'll see DrNursePaul every third Monday of the month for free NCLEX. That's guaranteed all year round. We've been doing this for more than a year. All right. So while we're waiting, we're going to talk about NCLEX very, very quickly, and then we're going to have a case study in a bit. So NCLEX, all right, now we're calling it Next Gen NCLEX since April 1 last year, April 1, 2023. NCLEX changed it to what they call the next generation NCLEX. NCLEX is basically the topics are divided into 8 portions, all right? And you can see the biggest part of the pie in the NCLEX test plan is actually management of care. Management of care talks about prioritization, emergency and disaster management, legalities, ethical principles in performing care, all right, to patients. And then, of course, following that is everybody's favorite, pharmacological therapy. All right, and my students who are joining me today, hello to my students. They know for sure that the only pharmacology lecturer or instructor in our class is me. All right, so I've been teaching pharmacology for more than 12 years. But that's my favorite topic, all right? And I would love to teach you guys one of these days if I can do a live class. But my pharmacology is long. I usually split it in 2 days. But probably one of these days, let's do a pharmacology free class. Okay, how about that? But pharmacology, 16%, followed by safety and infection control. And then you have physiological integrity, reduction of risk potential, basic care and comfort, health promotion, and psychosocial alteration. So those are the components of the NCLEX. Post your questions if you have questions I can answer live right now before I go to the case study. Minimum and maximum items, minimum items 85, maximum 150 for a total of 5 hours. Now, if you guys are familiar, if you've attended one of my free classes before, I've talked about computer adaptive testing. NCLEX is computer adaptive, which means we all take the exam same time, but we're all going to see different questions, all right? The exam, all right, has a computer adaptive algorithm, which means it bases the next question from your previous answers, all right? So every time you answer a question, it scores you and sees if you're correct or not, right? If you're correct, it gives you a harder question. If you're incorrect, it gives you easier question. And then it goes on and on until it reaches 85. At 85 items with 95% confidence, the computer thinks you're passed, it's gonna stop. If it also thinks 95% confidence you failed, it's also gonna stop. It will not tell you if you pass or failed. You'll have to wait for the results after 48 hours. Okay? But if it's not sure if you're gonna pass or fail, because you may be borderline, it will keep continuing until it reaches the maximum number 150. But you can stop anywhere between 85 to 150. I had students that stopped at 97, 98, 120, 121. And you guys are lucky because during our time, right, before the pandemic, NCLEX is actually up to 265 items. And I had students who went all the way to 265 items. That's very exhausting. All right. Now maximum is 150. All right. It doesn't matter what number you stop. There's only one goal for you to pass the NCLEX. The good thing with NCLEX is only pass or failed. All right. And with NCLEX next gen version, or next gen NCLEX, NGN is what I call it, right? There's new types of questions now. We still have your multiple choice, your favorite multiple response or SATA. We have your matrix, which is tables. We have drag and drop. We have drop down. We have highlighting text. I'm going to show you guys one example later. We have bow tie. If you guys attended my March free class, remember back in April, I missed my class because I was on vacation. And my March free class, if you missed that, it's in my YouTube channel. It's also in my Facebook. All right, I did 2 bow tie questions. So go back to that, see what bow tie is, especially if this is your first time hearing about Next Gen NCLEX. All right, and case studies. Today, we are going to do one case study. And what is a case study? Case study is basically what it is, all right? There's a case. We're going to read a case. It's like reading a patient's chart, all right? We're going to read the chart. We're going to see what's going on based on your history and physicals, basing on the nurse's notes, basing on the progress notes by the physician, basing on the labs and diagnostics and orders, all right? So we're going to see the development of the case. It's unfolding, which means as you move through the case, there's more information adding. It's like following a patient in a real clinical scenario. And why are we doing this now in Next Gen NCLEX? Because the NCSBN, National Council State Boards, want to evaluate your ability to critically think in a clinical situation, all right? And since nursing is clinical anyway, the best way to do that is to do a case study. So it's your clinical judgment, all right? Such that there will be 6 questions. First question will be about recognizing cues. Second question would be about analyzing cues. Third is prioritizing hypothesis. 4 is about generating solutions. 5 is about taking actions. And 6 is about evaluating outcome. For more information about Next Gen NCLEX case study, go to my YouTube page right now. I have a playlist there, and it's called The Secrets of Next Gen NCLEX. I think I did more than 20 free classes last year, back in 2022 and 2023 at the start of Next Gen NCLEX, because it only started last year, April 1. I did so many free classes, so many case studies, so many important resources, even test-taking strategies that I teach my enrolled students who paid me for their classes. I also taught that for free. Everything is available in YouTube, all right? So follow me. There's already 140 viewers in my page. Thank you guys for joining today. And that's it for Next Gen NCLEX. Again, one more time before we officially start with the case study. If you want to win an NCLEX full review course under the DrNursePaul method under Aspire RN. We call it the DrNursePaul method because I was the one who made the curriculum, all right? With personal mentorship, guys. You join group classes, but even though you join group classes, very important for me, guys, to individualize your experience. Kind of like when nurses, when we're providing care for patients, right? We don't treat them the same because each individual is different. I also believe the same is true with nursing students taking the NCLEX. All of us have different abilities, right? So it's important that your review course is personalized and individualized, all right? So we do a lot of live sessions, but we also do lots of personalized mentorships, one-on-one mentorships, all right? That you can contact your mentors and ask for advice, all right, on top of your classes. So real value for money for worth 550. I'm gonna draw one lucky winner. All right, join the raffle today. I'm gonna post the raffle link again. If you cannot click the QR code, I'm gonna post the raffle link on my page. All right, and our AMN host, our show director, Miss Milanis, will also post it for our AMN followers. All right, and thank you for those who are joining. Also to my students. Donna said, I shared your live with friends and I'm a proud product of Aspire RN. Thank you so much, Donna. Ooh, I have so many students that sometimes I forget their names already, but their faces are familiar. Donna, thank you for trusting Aspire RN. I really appreciate that you trusted Dr. Nurse Paul and Aspire RN for your NCLEX needs. I hope we were able to impact you positively because my goal for my nurses is not only to pass, but I want to be able to motivate them, all right? To make sure that the NCLEX is such an enjoyable, not stressful, it's already stressful to prepare for the exam, but an enjoyable experience, something that you can be proud of because you worked hard for it, right? I'm all about positivity and optimism and empowerment, right? If anyone follows me and knows my story, I came from very, very poor background, but I'm now here in the US enjoying the blessings of the nursing career, all right? And I was able to share that and impart that to many nurses like you guys, also to my family, all right? So I'm using my story as an empowerment, all right, as a motivation for nurses like you, that if I could do it from a nobody, all right? I remember when I was a nursing student, I was studying under a candle because we don't have electricity for years, right? If the candle runs out, I'm done studying, right? But here I am looking back 17 years of nursing history, right? And now I'm nurse practitioner here in the States, looking back at all those things, all right? It was a wild ride, like a roller coaster story, but I'm happy to say that I am here and I'm inspiring many nurses to help them pass the NCLEX, all right? Thank you guys for those who are following me and believing in me. All right. Any questions about NCLEX so far? Again, one last call for one lucky winner. We're probably going to flash this again later. We are about to start a case study. Kane is said, Aspire and I'm watching you from Ghana. Writing soon. Good luck, Kane. Thank you for joining the show today. We're going to take a quiz. So hold on. Harmon is watching us from UAE. Anna, good morning, Anna. Anna is my best friend and also one of the instructors in Aspire RN and also one of my co-hosts in our podcast. We do podcasts every Sunday, all right? Empowerment for immigrant nurses. So guys, follow me on my social media, okay? Because we do live shows every Sunday. It's 8 a.m. Central Time, Central USM, because I'm from Central. So I'm the producer of the show, but my co-hosts are Anna and Kay. We've already done 30 episodes so far. So many good information if you're moving here to the US. It's going to be available in Apple and Spotify very, very soon. So tune in. All right. All right. So everybody ready for a quiz? All right. Everybody who will pass the NCLEX, can we use the comment section right now and let's declare with all confidence right in the comment section, yes, I can. All right. All caps. Are you going to pass the NCLEX? Say, yes, I can. I believe in that power of words and optimism and positivity, all right? Believe in law of attraction. If you think positively and manifest positive things and speak positive words, positive things happen to you. Positive energy goes back to you, right? Yes, I can. Woohoo! All righty, we're going to do a case study now. Without further ado, thank you for all those who are joining us in the live session. And this will be recorded, don't worry. So you can still tag your friends. They can watch it forever, anytime they want. Just tag them here, tag your friends, okay? So they can watch it later. Some of y'all might be working or some of y'all might be sleeping. I have students from Australia. It's kind of late in Australia right now, all right? But you guys can tag your friends so they can watch it later. All right, let's now do an NCLEX case study. All right, you guys help me answer this, okay? I wrote this question about 2 days ago. It's an original question that I wrote. So let's see if we can answer it. For me, it's easy. All right. So I think you guys can handle this very, very good because it's a very basic NCLEX topic. All right. Common topic in the NCLEX. But let's see how you guys do. Okay. You ready? Let's take the quiz. All right. Here's our case study for today. All right. If you're watching from a phone, just zoom in your screen. This is how your NCLEX screen would actually look like, all right? So let's read this. Nurse's notes, all right? At 8:30 a.m. in the ED or emergency department, Miss Thompson was brought to the emergency department by ambulance at 3 p.m. Why is it 3? I'm sorry. That should have been earlier, right? That should have been 8 a.m. Sorry, guys. Didn't proofread. After being found unresponsive at home by her husband, who reports that she had been feeling unwell for the past few days with symptoms of fever, chills, productive cough. Over the last 24 hours, she became increasingly lethargic and confused. She has a history of type 2 diabetes and hypertension. She has been compliant with her medications. Upon examination, Miss Lisa Thompson is a semi-conscious and unable to provide a coherent history, right? How about we click the tab at the top? In the NCLEX, you'll see tabs now, all right? In the Next Gen NCLEX, you'll see tabs. It's like reading a chart, right? Reading a chart. Jean, you can stay. Jean said, nakakamiss makinig. That's Filipino to say, oh, I miss listening to classes. Well, you can stay and listen, all right? You can join us, don't worry. Even if you passed the NCLEX already. It's still, very good mental exercise. All right, guys, let's look at the physical exams for Miss Thompson. Vital signs, constitutional, it should be the other way. Constitutional, patient appears critically ill, diaphoretic, and lethargic. I'm sorry, my labels are the opposite. Vital signs, BP, 85/55, good or bad. Blood pressure, pulse, 120. RR, respiration, 28. Temperatures, 102.6. We use Fahrenheit in the States. It's 39.2 in Celsius. SpO2, 88%. Mill already has her answer. Neurological status, the patient is semi-conscious, disoriented to time, people in place, or time and place. Response to painful stimuli. All right? Cranial nerves, unable to assess fully due to patient's mental status. ENT, we have dry mucous membranes, no jugular vein distension. Pulmonary, we have tachypnea, decreased breath sounds, and the right lower lobe crackles heard bilaterally. Cardiovascular, we have tachycardia with irregular rhythm, weak peripheral pulses. Gastrointestinal, we have soft, non-tender, hypoactive bowel sounds. And skin, we have cold, clammy, mottled extremities. All right. Those are your findings. Now, let's look at your question. This is our first question. Remember, there's 6 questions in case studies, right? The first question is, based on the patient's presentation and physical examination findings, select the findings that need priority intervention. Select all that apply. This is your favorite, guys. Select all that apply, all right? Now, in the NCLEX Next Gen NCLEX, there are now 200 viewers in my own page alone, not including AMN. So we have more than that for sure. Guys, in Next Gen NCLEX, SATA questions or select all that apply, all right, is right minus wrong. Be careful. The scoring system here is right minus wrong. If you answer something that is not in my answer key, you get a deduction, okay? Be careful. So put your answers on the box now. Put your answers in the comment section. What are your answers? People are posting their answers already. Very good. Come on, come on. I'm waiting for more answers. I'm waiting for more answers. Let me fix this real quick. All right. I'm seeing more answers come through. I'm waiting for your answers, guys. Come on. This is very interactive. And I'll show you the answer in a bit. Is it DKA? We'll find out. Somebody said DKA. All right. I see about 15 people already provided their answers. How about the rest? Very good. I like how you guys are very participative. Anna, thanks for watching with me. Anna's doing a live tally. She said 202 viewers so far. Thank you, 202 viewers. I did not deserve your time today, but thank you so much. Appreciate you. And for following me, thank you as well. Tell me what content you guys want me to create. As long as it's related to my expertise as a nurse, as an immigrant nurse, I'll be willing to do it for you guys. All right. And for those watching an AMN page, you can also follow me, DrNursePaul, because I also do free classes, free NCLEX content, reels, and all that related to NCLEX and life here in US, just to inspire. All right, let's see your answers. All right, BP, yes. Pulse, yes. I'm going to click that. Those are priority findings. Respiration, yes. Temperature, yes. SpO2, yes. All 1 through 5 are included in our options. All right, 1 through 5 are included. Okay, why? Those are abnormal vital signs. You click abnormal vital signs as priority findings. Why? That's why they're called vital signs. They are very important signs, correct? They are actually talking about airway, breathing, and circulation. So you want to click all of those 1 to 5 as part of your options, right? What else? Are we going to click hypoactive bowel sounds? Let's hear from the crowd. I haven't seen anyone click number 6. Hypoactive bowel sounds. Is that something that I'll prioritize? When I say priority, patient might die from complications within 15 minutes or perhaps 30 minutes. Is hypoactive bowel sound? I'm an ER nurse, okay? My background before I became a nurse practitioner was an ER, right? If you give me somebody with hypoactive bowel sound, I will not take that patient seriously for the moment, right? It may be a problem, but I have never heard someone die from hypoactive bowel sound, correct? All right, so the key is, yes, it is abnormal, but no, it is not a priority because I don't see any complication with no bowel sound at the moment, right? People can have no bowel sounds for days from constipation, correct? So 6 is not included. All right, how about weak peripheral pulses? Yes, I need to consider that because that's circulatory assessment. Lethargy, yes, because that's neurologic assessment, number 8. Number 9, dry mucosa. Should I prioritize dry mucosa? Guys, I don't have sepsis, I don't have dehydration, I don't have medical crisis right now, but I think my mucosa is dry because I haven't had water this morning, right? That's not a priority. How about decreased breath sounds? That's airway breathing. All right, that's also a priority. So the answers are, let me see my slide. Boom. 1, 2, 3, 4, 5, 7, 8, 10. If anyone answered 6 and 9, you get deductions for extra answers. Remember, in the Next Gen NCLEX, for select all that apply, you get deductions for extra answers. Now, what's your score? Total points to be had is 8. If you answered 6 or 9 or missing some stuff, then you deduct accordingly. Kent's got it all. Very good. What a good warm-up question. And we have 5 more questions. Very good, Kens. How about the others? Don't be shy. It's okay to make mistakes, guys. We're not trying to take the NCLEX to get perfect scores, right? I took my NCLEX a long time ago, by the way, 2008. You can look me up. nursesees.com is where all our licenses are published. You can look me up, Paul Biluan, and you'll see that my very first license is New Mexico back in 2008. All right? And even then, just like you guys, I don't know many things, but all I had was a big determination that I will pass the NCLEX because yes, I can. All right. So don't be scared. You got 5 points. You got 4 points. That's good. Our goal is to improve that. Right. If you got 8 points, that's good as well. All right. 7, 6, 5, 4. Good. 3. Good. 2. Good. 1. Good. Well, not that good, but 1 is better than 0. Agree? All right, but I think this is an easy warm-up question for everybody. So that's our case study. Let's now go to the second screen, all right? Let's see, it will click next, all right? Well, actually, this is a PowerPoint, guys. So I'm just tricking you, looking like I'm clicking it. In the actual NCLEX, you're actually going to click next. This is how the actual NCLEX looks like, right? Same color scheme, same screen, all right? Exactly the same. We're going to click next. All right. So nothing changed. One of the test taking techniques I tell you guys is look at your tabs. Was something added? Are there new information on the screen? There is a new information. There's no new information, right? It's the same information, nurses notes and history physicals. If there's no new information, let's now go straight to your questions. All right, question number 2. All right, number 2 is about analyzing cues. All right, there are now 200 viewers in my page. Thank you so much. Drag and drop the appropriate lab tests and diagnostic tests to complete the following sentence. Angelica's exam is in 5 days. Good luck, Angelica. Do your best. Give me a feedback when you pass, okay? And go to my page. Maybe you can learn something from my previous classes. Maybe it can help. Watch my EKG class, Angelica. All right, if there's a tip that I can give to you, watch my EKG class. It might help you. Atrial fibrillation comes out in the NCLEX a lot. All right, drag and drop the appropriate lab tests and diagnostic tests to complete the following sentence. What are your findings? Well, I cannot drag and drop this. So you just give me 3 things that you think will be included. In the actual NCLEX, you're going to click and drag and put in the boxes. So what can I put in the boxes from the choices below? Chimi is joining us from YouTube. She already has answers. Thank you. How about the rest? Punita just put her answers in. So we have people from Europe, from Asia, from Africa. I'm just checking all continents. From US. Are there anyone here from South America so we can cover all 6 continents? Actually, in Australia, I think we're representing 4 continents in our class today. Just checking if there's anyone joining us from South America and Australia. Krishna has answers. Karen has answers. Ree answered. Capri can't answer. You can put it in the comments box. Aki is joining us from Australia. Woo! 5 continents so far. Anyone from South America? Where are my South American followers? Harshani is still answering the first question. Probably joined a little late. Hashini already provided her answers. Very good, Hashini. I'm going to see you in the class. Kent already has answers. Burns already has answers. How about the others? Mika is from Middle East. Good. Joseph is from Temple, Texas. You're about 4-hour drive from me, Joseph. You're closer to Dallas. I finished my NP school and my doctorate school in TCU. You're 1 hour away from my university. I used to drive there a lot for school. Jade is from Massachusetts. Woohoo! East Coast. All right, I think we got the answers from many people. Let's see if you guys are correct. The good thing with drag and drop, it's not right or wrong. If you're correct, you get 1 point. If you're incorrect, then no deductions at all. All right? So what are the answers? Do we need lactic acid? Yes. Do we need blood cultures? Yes. Lactic acid will tell us how bad the sepsis is. Beyond 2 or 2.2, the higher the number, the worse the acidosis. You remember, when you are septic, when you have bad complications with infections, your body becomes acidotic, so lactic acid is being produced, right? Blood cultures are also needed, especially with sepsis. It looks like our patient has sepsis, by the way, if you guys haven't figured it out. It looks like it's sepsis, right? We need blood cultures to identify what bacteria so we can target the bacteria with the correct antibiotic, right? But of course, blood cultures don't come in till 1 or 2 days later. You know, they can do initial read and say, oh, it's a gram positive. Oh, it's a gram negative. And then 2 or 3 days later, they say, oh, it's actually E. coli, right? And CBC is important because we need to know the white blood count. Do we need D-dimer right now? No, right? D-dimer is a test for clots. So we may need it if it's clotting related, but we're talking about sepsis right now, which is, what's the cause of sepsis in this situation? Can you guys figure out? Remember, sepsis is infection, right? Based shock, right? With infection, there should be a source. Based on your findings, where is the infection coming from? Right? In your nurse's notes, I think it's coming from the lungs, right? Because patient has, hold on, I think I posted the history and findings incorrectly. This is your actually history findings. This is the actual one. I might have incorrectly pasted it to the other screen. Why is that like that? All right. Anyway, I didn't see that. Anyway, so this is your findings. You see pulmonary, tachypnea, decreased breath sound, crackles, and then sepsis sign. So it might be pneumonia. The answers are, don't look at this. This is incorrectly pasted. All right, that's incorrectly pasted. So we need CBC. It looks like this is pneumonia. I need to know white blood count. D-dimer is not important right now because this is a test for clots. Do we have pulmonary embolism? Troponin is a test for MI. It might be needed, but that's not a priority right now. We can only choose 3, right? Now let's go to, there's now new information. New information, third tab opened up, all right? So who got 3 points in the question earlier? 3 points earlier. Anyone got 3 points? Total 3 points to have in the last question. That's question number 2. Let's now go to question number 3. We have now new information about this patient. Complete blood counts. What did we see? White blood cell. What are the abnormal findings here? CBC, what's the abnormal? White blood cell is increased, right? So we have leukocytosis here, right? So which means there's infection for sure. Hemoglobin is normal. Hematocrit is normal. Platelets 150. That's one good thing with case studies now in Next Gen NCLEX. You now can see normal values, okay? So, you know, back in our time, we have to memorize all lab values. We have to memorize it for the NCLEX. You guys are lucky. You don't have to memorize anymore. You can see the normal values on the screen during your NCLEX. Woohoo! That's one of the good things that happened with Next Gen NCLEX, right? Let's look at your basic metabolic panel. Sodium looks okay. What's the problem here? Anyone finding anything significant? Potassium looks okay. Chloride looks okay to me. Bicarb is a little low. Right? So bicarb is alkaline. So if it's low, your blood is acidic. That is correct because sepsis causes acidosis, right? BUN is a little elevated. Creatinine is 1.8. All right? When creatinine is 1.8, what is the problem? Glucose is also 180. When creatinine is 1.8, you want to look for problems with the kidneys, right? So the kidney is probably starting to fail. Can sepsis lead to multiple organ system failure? Yes or no, nurses? Yes. So be careful with that creatinine. Some antibiotics that we're going to give, especially vancomycin for sepsis, if we're targeting gram-positive bacteria, can damage the kidney further, right? So keep an eye. If you're a near nurse, ICU nurse, so we'll be taking that patient in, keep an eye at that creatinine because I don't like that. That signals acute kidney injury, which can be a complication of sepsis, multiple organ system failure. Lactic acid is extremely high, 4.5. Normal is up to 2.2. So now we've proven that there is what? Sepsis, right? From the increased lactic acid, white blood cell is increased, there's acidosis, creatinine is already increasing. And look at the x-ray. X-ray says there's right lower lobe infiltrate consistent with pneumonia. So we know that the patient has sepsis. Agree? Yes? Let's now answer the question. Based on the presentation, physical findings, and lab, select the lab test, laboratory tests, and diagnostic criteria that are necessary for diagnosing septic shock. All right? So there's many levels for sepsis. If you guys are not aware, I'm waiting for your answers. Put it in the comments right now. Come on, come on. Let's answer this. But while waiting, all right, there are many levels for sepsis. So the first one is called SIRS, or Systemic Inflammatory Response Syndrome. So usually you just have tachycardia there, tachypnea, hyperthermia or fever, right? And possibly increased lactic acid WBC and a source of infection, right? So when we have positive source of infection, like a wound or like pneumonia in the lungs or like urinary infection, then that becomes what we call sepsis. And then the third level, so SIRS, sepsis. So sepsis has positive labs of lactic acid WBC increase and a source of infection. And it becomes septic shock when the blood pressure is low. All right. So septic shock, so 3 levels: SIRS, sepsis, and septic shock. When septic shock is our diagnosis, it means that the blood pressure is already low. So when the blood pressure is low, it's not just sepsis, it's septic shock. And you go back to your patient's case, the blood pressure is 85/50 something, right? So we want to consider that. So what are the diagnostic criteria? Remember, extra answers get you deductions. Extra answers get you a deduction, all right? Extra answers get you a deduction. So let's see the answers. The answers are, I'm going to answer 1, I'm going to answer 3, I'm going to answer 4, I'm going to answer 6, I'm going to answer 8. 1, 3, 4, 6, 8. 2, we're not worried about hyperglycemia. That's probably another problem or incidental finding. We're not worried about that's because when you're diabetic and you're stressed, you produce more sugar, right? BUN and creatinine are not a problem right now. I'm just saying it's a complication of sepsis, but it is not required to diagnose sepsis. You got it? The question is about diagnostic criteria for diagnosing septic shock. I just mentioned them, right? Low blood pressure is part of septic shock. And of course, source of infection, and our source is the lung, right? There's pneumonia, so that's our source. 1, 3, 4, 6, 8. Any answers more than this, you get a deduction. All right? You get a deduction. All right? So if you've answered, somebody answered 2, then you get 1 deduction. You answer 2 and 5, you get 2 deductions. 7, you get 3 deductions. So you now know, guys, what I'm talking about, right? The problem with select all that apply and other questions that have right minus wrong scoring system is if you answer too much, you get deductions. So be careful. If you're not sure, one of the test taking strategies, if you're not sure, don't click it. Because if you click it, you're more likely to make a mistake. You got it? You got it? Because it's right minus wrong, right? Not all questions are right minus wrong. There's only 5 of them, all right? Your SATA included, your highlighting included, all right? Why not number 2? Yones, all right? Is that your name? We're talking about diagnostic criteria for septic shock, all right? Sugar is abnormal, right? But it is not required to diagnose sepsis. You got it? For sepsis, you have to have low BP, septic shock, high pulse rate, high respiratory rate, low oxygen saturation, increased WBC, increased lactic acid, and source of infection. You got it? Hyperglycemia is a complication coming from diabetes and not necessarily septic shock. You got it? All right? If we only answer 4, say for example, the correct answers are 5 and we only answer 4, do we get a deduction? No. You don't get a deduction if you don't click it. You got it? If you don't click it, you don't get a deduction. If you click it and that's not the right answer, you get a deduction. You got it? All right. 3 more questions, okay? Last call. I'm just going to flash this one more time and going to post the raffle, all right? I might not be able to draw it right now because we have 10 minutes left to end the class, but sign up now for a raffle. I'm going to post the winner within the day, all right? But if you sign up now, all right, you can win 1 free NCLEX full course worth $550. All right? Okay, and then going back to the question, John is correct. John said the hyperglycemia might actually be related to many factors. And that is totally correct. Not necessarily sepsis. But remember, the question is about, that's not a question. The question was about diagnosing sepsis only. We're not looking for all the abnormal findings. All right. Now next, nurse's note, same history, physicals, labs, imaging. Nothing was added. Let's now go straight to the question. So I checked the information. Nothing was added to the case. Let's now add to the question. Based on patient's presentation, physical exam findings, and lab, the nurse will anticipate which intervention. All right. Did you guys see the question? It says select how many. Select how many. All right. Select how many. 3 answers only. Did you guys read it? Select 3 answers. So guys, listen. This is not select all that apply. All right. In NGN, this is a question type we call select N. All right. Which means a number. You got it? So guys, this is different from SATA. In SATA, you select everything that you think is correct. Here, you only choose whatever number they say. And this is not, listen to me, this is the good news. This is not right minus wrong. All right? So I know you guys don't like SATA. It's already hard. And now it's right minus wrong, which is even harder. Right? But guys, again, for this type of question, this is not right minus wrong. It's plain 0/1 or point per correct type of scoring. And this may be confusing for those that have just joined me, because in NCLEX next generation NCLEX version, there's different types of scoring system. If you guys are confused, go to my YouTube channel right now and find that secret of next generation NCLEX. And I discussed everything about next gen NCLEX with many case studies, bow tie questions that you guys can study, all right? Especially if you're going to take the NCLEX soon, okay? So going back, what are your answers? Select 3. Select 3. Select 3. Basing on sepsis, your patient has septic shock, the blood pressure is low, lactic acid is high, WBC is high. What do? Do we need to start antibiotic? Yes, we need to start that within the first hour, all right? All right? Insulin, we're going to put off insulin for now. I know you guys know that the sugar is high, but that's not my priority. I can only choose 3, right? I need to give IV bolus to increase that blood pressure, and I need to monitor vital signs every hour. Guys, hold on. Oh, hold on. There's 4 answers. I'm sorry. I'm only going to choose 3, all right? I think this is originally a select all that apply question when I wrote this, but I changed it to select only 3. The correct answer is only 1, 3, and 4. We're going to take out 5, all right? We're going to take out 5. I'm going to explain why. Is 5 correct answer 2? Yes. 6? No. 2? We'll put off. That's not a priority. 5 is correct answer, but guys, it's not a priority right now. During the first hour of sepsis, your goal is to just insert an IV and bolus the patient with fluids. You got it? If the fluids go up, then the blood pressure is already managed. Then you're not considering the patient septic shock anymore, right? We usually give 30 mLs per kilogram. So up to maximum of 3 liters, depending on your hospital policy, as long as they don't have CHF or kidney disease, right? We bolus them so the pressure goes up, right? If the pressure don't go up, then that's the time we consider ICU admission and we put central venous catheterization for vasopressors. You got it? So yes, CV catheter is correct, but that's not a priority right now. We can only choose 3. So let me correct what's in the screen. 1, 3, or 4. So Angelica said, do you get 3 points or 0? Good question. You get 1 point per correct answer. The good thing with Next Gen NCLEX now is it's partial scoring system. So if you click 1, 3, and 4, you get 3 points. If you only click 1 and 3, you get 2 points. You got it? So I think that works really good for you guys, because 1 or 2 or 3 points is better than 0. You got it? So partial scoring. You got it? So you can accumulate a lot of points actually. Answers 1, 3, and 4. I'm going to unclick 5. I can't do it because this is a slide. I'm going to unclick 5 because this is originally a select all that apply question. I changed it to select 3 answers only. All right? Leonis, it's hospital dependent. She said, is it right to do every hour or every 30 minutes? The standard is every hour for septic shock. That's the guideline. You got it? If you want to do it every 15, every 30 minutes, that's depending on your hospital policy. If the hospital policy says, okay, for septic shock, we'll do every 30 minutes, that's totally fine as well. But the basic or standard guideline is at least every hour. Okay, Leonise, you got it? At least every hour for ICU, critical, highly critical patient. But again, if you're starting to give vasopressors, maybe we need to do it more, right? But there's no vasopressors yet. We're just giving fluid bolus. So the idea is get your initial vitals, give your bolus for 1 hour, recheck the vitals. All right? So that's it. That's the basic standard. I know I've worked in some trauma hospitals. We do every 15 to 30 minutes. Right. Okay, next. We now have a new finding. All right? We're going to probably extend a little bit here, because it's already 5 minutes left to the clock. Ooh, I'm enjoying this class so much. You guys are so participative. Thank you. Let's read. Let's read. There's another question. 1 hour after administering the bolus, Lisa Thompson's blood pressure has not improved. BP remains low at 80/50. She continues to exhibit signs of poor perfusion, cold, clammy skin, altered mental status. Heart rate is still 125. Respiratory rate 30 breaths per minute. SpO2 89 on 2 liters. Why are you still on 2 liters, Lisa? I don't know what they're doing to you. I'm sorry. The attending physician has been notified for persistent hypotension. Guys, is Lisa now in septic shock? Remember, we already gave bolus fluids. Yes or no? And the BP is still low. Is Lisa already considered in septic shock? Yes or no? The answer is yes. All right? So remember, did Lisa have COPD too? Oh my goodness. Anyway, Miss Lisa Thompson, yes. So patient's not doing good. This is now septic shock. Let's now see what interventions are you going to click, all right? So this is called matrix, all right? You're only going to click one per line. Is it indicated or not indicated? Okay? And partial scoring, again, for every correct answer, you get a point. For incorrect answer, you do not get a deduction here, all right? Okay, so let's see. Start vasopressor therapy. Yes? Indicated, right? Administer additional fluid bolus. Indicated. Actually, that's not indicated. All right? You only give 1 round of bolus of 30 ml per kilogram. That's our protocol. All right? If you already gave 3 liters, guys, my goodness, don't give another liter. All right? Because now the patient's going to be fluid overloaded. I don't know where all those fluids are going to go. That patient's going to have bipedal edema, or I don't know. Don't give too much fluid. It might migrate to the lungs and cause pulmonary edema. All right, we don't like that. So guys, not indicated. Admit the patient to ICU. We're still in the ER. Yes. Oxygen to high flow nasal cannula. Yes, indicated. Clear liquid, clear liquid, clear liquid, or NPO. Clear liquid or NPO. No, don't start fluids, all right? If you have septic shock, I'll put you on NPO, not indicated, right? You're not going to eat. I'm sorry. You're going to TPN, all right? But you're not going to eat. You're in septic shock. We don't want any more complications from you choking, all right? Prepare for central line. Yes or no? Yeah, we talked about central line earlier, but it's out of the options because we only need 3. Yes. So the answer here is, that's the answer. Who got 6 points? Who got 6 points? And one last question. Woo! Now there's like 260 viewers in my page alone. That's not including AMN. Thank you guys for those who are joining. And don't worry if you guys didn't catch the first part, because this is recorded. Right after the show, you immediately access it in AMN webpage or Facebook page, and my Facebook page or YouTube. It's immediately available for you. Power of internet. Information available for you immediately. All right? Good job. 5 points, 4 points, 6 points. Those are good scores. All right? Good job, everyone. All right, last. Let's look. All right? Now the patient is in ICU at 2 o'clock p.m. Patient was admitted to the ICU after persistent hypertension despite fluid resuscitation, vasopressor therapy. She is on non-rebreather mask for oxygen. Her BP has been stabilized to 100/60 with norepinephrine drip. She is more responsive but still disoriented to time and place. Her SpO2 remains low at 85% on a non-rebreather mask. A lung CT shows bilateral pneumonia. New lab results indicate increased creatinine to 2. Bilateral crackles are noted in auscultation. Urine output is about 40 ml per hour. Abdomen is soft and non-tender. Now, the last question will be click to highlight the findings that require priority. Remember, last question is about evaluating outcomes. So we're now evaluating if our management was effective, which would indicate priority. I already highlighted the options for you guys. In the actual NCLEX, you can find the options by scrolling, and you'll see yellow bars come up like this, right? Those are the options. You don't have to click or highlight manually. You're just gonna click the findings that you think are abnormal. What are the findings that are abnormal? There are different options here. The BP, the responsiveness or LOC, the SpO2, the lactic acid, the creatinine, the crackles, and the urine output. So 7 options. You only click what you think is priority. And be careful. Listen to me very, very carefully. This is our last question, right? The highlighting question is also right minus wrong. It's like SATA, just in a paragraph form, all right? Be careful. Right minus wrong. If you click something incorrectly, you get a deduction, all right? Get a deduction. So what are your answers? Come on. Don't be shy. There's 7 options there. All right. I see about 10 people putting their answers. We're almost done. We're 2 minutes over. I'm so sorry. Thank you to AMN for hosting the show. I'm enjoying this show, guys, by the way. Do you want more of these classes? Do you want me to do more free classes? All right, I'm going to show the answers now since a lot of people already provided their answers. The answers are in green, all right? So BP, no longer a priority because it's stabilized. 100/60 for me is good. If you compute that map, that will be over 60, all right? Responsiveness, I'll still check that. I don't like that LOC. Patient's not getting better. She's still disoriented. Brain is probably hypoxic still. SpO2, I don't like that 85%. This patient's going to get intubated, right? Lactic acid already went down from 4 to 1.8. Good. Septic shock is already over. Creatinine is increasing to 2.0 from 1.8. I don't like that. The kidney's already starting to fail. Crackles, I'm going to check that. We still have pneumonia, and pneumonia can still cause problems, right? Urine output is normal, so that's not a priority. We have 4 answers, 3 incorrect answers. If you click any of those 3, you get a deduction. How many scores did you get? How many points did you get? How many points did you get? And I hope you guys enjoyed this show. We're not yet done. We're not yet done. And yeah, you'll see me every month, 3rd Monday of the month, live streaming on my page at DrNursePaul right here. All right, right here. And also in AMN Academy. So we're co-hosting this show. Thank you, AMN Academy. Thank you, Aspire RN. And if you are interested with my review program, guys, pass the NCLEX through the Aspire RN way, the DrNursePaul method. We have intuitive online portal. We do classes virtually. You can access the portal 24/7, review your classes. You attend the live. You cannot attend the live. Classes are recorded. You can review it anytime, anywhere, any which way you want, all right? We have NGN ready questions. And we also provide individualized mentoring on top of your live sessions. The Aspire RN difference, you have Next Gen NCLEX confidence, you have personal mentorships, and you have my guarantee that if you finish my course, you have 100% guarantee that you will pass the NCLEX, all right? Otherwise, I'm going to review you again until you pass, all right? Unlimited review until you pass if you complete the DrNursePaul method. That's what sets us apart. We're committed to your success. All right, we're gonna help you pass. All right, we have 3 options in our website, aspirern.com. I prefer full course, so you can really develop your content and master content and answer all the questions in the question bank. If you do it full time, you finish it in 16 weeks, but you can take your time, your own facing, and unlimited access for 1 year if you're active. The other one is Crash Course. You can access it for 45 days. We'll do HIT classes with you. HIT classes is our final coaching. 10 days, 1,000 questions. We're going to rationalize everything for you, give you final tips for the NCLEX. If you're already about to take the NCLEX, right, within the next 2 months, this might be for you. And right now, we're doing a promo. For Filipinos, it's only 20,000 pesos. I'm gonna say this in Filipino. Mura na at kayang-kaya pa. In English, very affordable. All right, you can do the full course for 20,000 pesos or crash course for 8,000 pesos. For international nurses, the full course is $400. 20,000 pesos is about $400. That's $150 off from the regular price. And I can also give you discount for the crash course. That's somewhere around less than $200. So send me a message right now or scan this QR code to direct you to the Aspire RN page. Send me a PM. I'll walk you through the NCLEX preparation. I'll give you my DrNursePaul guarantee. We'll help you pass. We'll bring you here to the US, Canada, or Australia. I'm here, committed to your success. That's a DrNursePaul method. Enroll now. Webpage, aspirern.com. And yes, you can. All right. So I don't have time to do the raffle, but I promise you within 24 hours, wait on my page, DrNursePaul. Go to my Facebook page right now. All right. I'm going to post the winner. All right. All right. We're going to roll the dice, or what do you call that? The spinning wheel. And I'm going to show the winner, and you're going to contact me if you win. Wait on my page. Okay. And one more thing before you guys go. All right. I'm going to do a live session in Facebook and TikTok on March 29, 8 a.m. Central Time. This time, it's not going to be an NCLEX class. It's going to be a Q&A. Ask me questions about anything. NCLEX, immigration, visa, life in the US, how to find a house here, how to find a job, what do I look for in job offers, all right? How to buy a car in the US, how to get a house, all right? Everything, how to prepare for the NCLEX, what are the review tips. It's just going to be a Q&A session. And this is the best part. I'm also, March 29, it's a Wednesday, yes. I'm also going to give one more. No, I'm sorry. Why did I say March 29? May 29. Oh my God. May 29. No, not March 29. I'm sorry. Why am I stuck to March? Because I keep saying March this morning. May 29. May 29, 2024. That's next Wednesday. Correct? Check your calendar. May 29, 8 a.m. Central Time. Watch out for the announcement in my page. I'm about to announce it this week. I just finished this class, so there's no confusion with the live shows. May 29. May 29. I'm also going to award one free NCLEX again live on May 29. May 29, Wednesday, 8 a.m. Central Time. 8 a.m. Central Time. Ask me any questions. As long as it's my expertise, I'm going to answer you guys. It's not going to be an NCLEX interactive question, but you guys can, it's live Q&A because I get a lot of message in my page, but I don't have time to answer everybody. So what I thought about it is I'll put you guys all in live in Facebook and TikTok. Ask me any questions, 30 minutes, I'll answer it, and then we'll draw a winner for the NCLEX. All right, May 29, 8 a.m. Central Time. That's 9 p.m. in the Philippines, actually, Casey. All right. Thank you so much for joining me, guys. Watch out in my page at DrNursePaul. I'm going to draw one winner for today. I'm going to flash this one more time before I end this one. I'm sorry. I'm going to flash the raffle screen one more time. That's a QR code. All right. And find in the comment section. I'm going to post the raffle. I'm going to give you guys 1 more hour or 2 more hours. I actually have a class after this for 4 hours. So after that class, I'm going to draw the winner. I'm going to give you 1 or 2 more hours before the poll closes. If you watch this late, you can still join. And I'm going to award 1 winner in my page at DrNursePaul today. Thank you, guys. And yes, you can pass the NCLEX. Bye now.